Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline. We're coming to you live and direct from our Newsfirst studios here in Colombo. The economic crisis brought about many realities here in Sri Lanka, and one of the saddest unfoldings, of course, is the number of deaths that have been attributed due to the lapses in Sri Lanka's health system. Now, Sri Lanka's health system conventionally was known as one of the best, at least in South Asia. The connectivity among the different strata within the health sector was praised even by the World Health Organization. But where are we today, and how fast this collapse happened is, of course, very alarming, concerning and sad, to say the least. To discuss these matters and much more, we've got the President of the Sri Lanka Medical Association, Dr. Ariyaratne. A very good evening, Doctor, and welcome to the show.
Good evening, Shalin.
Doctor, first things first, when it comes to health, that is one thing that a person cannot, should not compromise on. But in today's context, you see people compromising so much on their health, not because they're complacent or they are unaware of the situation, but simply because they can't afford their medicine. There is a complete breakdown in the health sector of Sri Lanka, and I don't know if you tuned in to the parliamentary sessions on the no confidence motion against the Minister of Health. Whether or not the Minister of Health was involved in this, is to be blamed for this, is responsible for this, that's a different question entirely. But just to watch parliamentarians making representations in Parliament on behalf of the people with regard to this health crisis was shameful, to say the least, Doctor. So then, when we can't, really rely on our leaders, the leaders that we appointed in good faith to exercise or to use the sovereignty of the people and govern us, we look at professional bodies like the Sri Lanka Medical Association. Doctor, what has the Sri Lanka Medical Association been doing to bring Sri Lanka's health sector out of this utterly dire state that we're in right now?
Yeah, Shalan, thank you for giving this opportunity to SLMA. Sri Lanka Medical Association is a professional medical association. It's the apex medical association, which has the widest representation of all doctors in the country, and it's a organization with 136 years of existence. And our primary objective is, of course, to serve the doctors to improve their skills and knowledge and be responsive to the growing demands of the health sector. The other objective is to really do policy advocacy work to improve the health conditions of our people. Now, you asked me the question, in this crisis, what has SLMA been doing? Now, this is not, these are what I may call a polycrisis or multiple crisis here, which is manifesting in different ways.
Right.
What you referred to as the shortages of drugs and medical supplies, consumables.
The rise in prices also.
Yeah, of course. And also it's not just the rise of prices of the medicines, but also what you call the out-of-pocket expenditure by the public. Now I am sure you would have also obtained health services from the government sector. Now, I was born in a government hospital, and most part of my life I had obtained state health services, right? And as you said, we have been quite proud of our health system.
Exactly.
Because it was very equitable. It served all segments of our society, whether they belong to the lower socioeconomic class or different ethnicities. So, it was a equitable, fair healthcare system. So, we all know that it had deficiencies. I mean, there were drug shortages of doctors, but those were not systemic problems. The system as a whole was really working. But we have seen, very unfortunately, past couple of years, not just due to COVID, but because of bad management, what we call health governance. Of course, that also is part of the bad governance that is there in a larger context in this country.
So, who is responsible for the governance of the health sector, if I may ask, Doctor?
So, the state, it's not just the health ministry, but of course, the larger governance, if there is no control of corruption in the state system, it affects the healthcare system as well. Right. So, you have to enforce law. There are certain regulations that need to be adhered to. And if these are not being adhered to and not taken seriously by the politicians who are responsible for these sectors, as well as the administrators, then we are in this kind of pathetic situation. So, the COVID-19 in 2020 and 2022 had a big impact on the health system, but our health system was quite robust and the doctors were prepared and they responded very positively.
Even the World Health Organization commended the system
on our
in Sri Lanka.
exactly. So, what happened was the economic crisis of course put greater pressure on the healthcare system because we didn't have enough foreign currency to buy medicines and all that. So, SLMA at the very beginning we knew that these shortages were going to happen. As early as April last year 2022, the SLMA alerted the then president Gotabaya Rajapaksa that this situation is going to come. We are okay for the moment, but in 6 months time we will have a severe problem, right, and to streamline. And as SLMA we also was part of the solution. We know that we have to alert the doctors about optimal use of existing resources, minimize wastages, and that kind of discipline has to be brought to the medical community as well. So, we did a lot of things and also introducing some clinical regimes, clinical protocols that would be more effective in terms of reducing costs, and also not ordering unnecessary. I am not saying that even in routine practice they do unnecessary ordering of tests, but rationalizing in a situation where you have resource constraints, you can actually choose which one to be carried out on in a given patient. So, that kind of extensive training modules, all that were disseminated by the SLMA. Then continued to advocate with the policymakers, with the president, the health minister at that time, and particularly on the procurement of medicines. And also when there was that like these shortages, as an interim measure, all the professional colleges, College of Surgeons, College of Physicians, College of Pediatricians, College of Obstetrics and Gynecology, all got together and identified what were the urgently needed medicines, even for treatment of cancer patients. And then as a stopgap measure, they went ahead and got donations, following of course the procedure, all the registered drugs, and was somehow buffering to mitigate this negative impact on the health system. But of course, what we had seen is that then they were saying that there was not enough money, but we met the finance ministry officials and they said no, we are giving priority to the health sector. It is how you prioritize within the allocated budget on what medicines to be imported. So, what unfortunately happened was that the National Medicine and Regulatory Authority NMRA was not really functioning optimally. For example, even the board positions were not filled, and the critical ones where you need the representation of professional colleges, right, they were filled only after SLMA made representations directly to the president and put pressure on the government to fill these vacancies. Then there were also non-adherence to the given procedures in the NMRA Act. For example, waivering of registration,
emergency purchases,
there was a procedure for that. Of course, it is allowed, but not in very specific conditions, not this kind of crisis as they interpret. So, it became the norm rather than the routine practice.
Rather than the exception became the norm.
Norm, exactly.
So, doctor, now when we speak of a crisis, usually in the health sector or whichever sector, it's the main professionals, the professional bodies in that sector that really steps up. We are all currently experiencing a governing crisis, but during the height of this governing crisis, especially when matters of constitutional importance came up, we saw the Bar Association of Sri Lanka stepping up and fighting to ensure that the trust or the faith that the people have placed in the judiciary, in the legal system of Sri Lanka is not tainted, and that continues forward because that is important to us as a society. Now we are facing a situation where people's trust, people's faith in the health sector of the country is at stake, is tarnished, is compromised. So against such a backdrop, doctor, what really is the SLMA doing? Especially, let me take a few examples. For instance, there were several deaths that were attributed to the use of several drugs. Those batches were suspended and steps were taken in that way. There were representations made by the directors of these hospitals that this was an allergic reaction to that drug. And I do concede the fact that usually during a crisis, some small incidents that would otherwise go unnoticed become huge, massive national issues. But let's take, for example, the incident that happened at the eye hospital, where several people who went to get a routine cataract surgery done lost their sight, doctor. They lost their sight. And at a time like that, you see the health minister and members of the government coming out and saying the opposition is trying to taint the trust of the people in the health sector of the country. They are making statements in a way that people will not go to a hospital even if they are sick because they're so scared. But when these kind of things happen, doctor, can the people react in any other way really?
Yeah, so I think you gave the answer also. The politicization of the entire issue, I think, is the most unfortunate thing. Now there is a fact, that is there had been deaths. Of course, without proper investigation, you can't attribute it to a particular cause, although this anaphylactic reaction or the allergic reaction can be attributed. But right now, the most important aspect is the confidence of the people, the loss of confidence. That's a serious matter, because over a long time the confidence in the health system has been built. I mean, it's and also about immunization, vaccination. So once you lose the confidence of the people, the trust in the system, it's very, very difficult to restore it. So we knew that from the beginning. Now you asked about the trust in the judiciary. Now we also did we took first step as early as March this year. We filed a case at the Human Rights Commission regarding the shortages of medicines and this procedure not being followed. So we had 2 hearings, and the case is still going on. Then with our representatives, there were also public interest groups which went to the Supreme Courts and then got an injunction, and then now that case will be heard in October. So we have also been like part of that those initiatives as well, while also working on the solutions. So now how to correct this? Now if you look at the NMRA Act, you don't need to amend that. Now there's a committee committee appointed to again look at how this can be amended.
It's purely because of misinterpretation of the act or the provisions therein that would allow an easier route to probably give a few tenders to those close companies to you. That's the core issue,
also there are of course resource constraints. Now for example, laboratory testing. So post event testing is not the answer. I mean, you have other procedures. There's an ecosystem to ensure quality. It starts from the governance, the appointment of proper individuals to those positions, to having pharmacists and other technical personnel appointed to the authority, then also having laboratories which are fully equipped and so on. So I think you have to look at the entire system and then try to improve. And also in the Act, there is a National Advisory Committee that needed to be appointed.
But that wasn't appointed?
No, it was never appointed. I think it was appointed at the time that it was NMRA was the Act was enacted in 2015, but then that committee, I was made to understand, never met. So after 3 years it lapses. So now I think I have been also telling this to the authorities that as SLMA we would like the National Advisory Committee of the NMRA be appointed. And that hasn't happened, because that's another additional oversight.
But Doctor, is the government, the authorities that be really, listening to the views, the concerns of the SLMA? On a scale of 1 to 10, how happy are you about the response that you've got to the requests, the concerns raised by the SLMA?
If I rate, I'll say 5 out of 10, because at least…
You're on the fence, are you, Doctor?
No. I mean, it's just that it's more on the negative side. I mean, that's the fact.
Then it should be a 4.
I mean, So you can say it's 4. I mean, 5 is not acceptable. Even half is not acceptable. But
So you have very high standards, doctor.
but the fact is that it's not just SLMA. There had been other professional bodies which have been telling these discussing these issues and making recommendations. So there is some kind of impunity also. We can do anything we like. So that is very unfortunate. And also the interpretation of whatever being told with evidence, sometimes they are disregarded. So that's the sad thing. So we have to keep pressing. This is why I say that it's about governance, nothing else. So how much can we do? I mean, we are in a situation where we don't have any elections in sight, and so they can the politicians can do whatever they want, which is very unfortunate. So this lack of accountability is a very serious matter, and we are dealing with human lives. That's the difference here. So I think we need to have more public discourse on this, and then public need to put pressure. At the same time, I think as public, I think they should also take lot of precautions now to try to maintain their health, do health promotion work, preventive work, and also have more responsible behavior, so that you minimize the impact on the health sector as well. Because if you take, for example, the road accidents, if you have seen the last couple of months, large numbers, no. So it is reckless driving, the law is not enforced, so multiple factors, and it's the #1 cause of hospital admissions in Sri Lanka. Traffic accidents, road traffic accidents, and violence, trauma, which are very unfortunate. And when there's a shortage of medicines, particularly surgical reagents and supplies, most of these admissions require immediate surgical intervention. So just imagine the cost for this for the system, and with also the migration of doctors, particularly specialties like anesthesia and so on. It's having it compounds the situation. So I think we are, as your the topic suggests, we are at the verge of collapse of a system. So we have to do everything to prevent that from happening. So that's the urgency of the matter.
So, doctor, what really is the future for Sri Lanka's health sector now? We are staring at the light from the bottom of the barrel. Where do we go next? What do you see is the next immediate step that needs to be taken to ensure that this system that is just falling apart around us doesn't really flatten the entire system?
So first is that we adhere to whatever the regulations that are there, and try to somehow address the shortages of medicine, and also confirm to the quality standards. There are mechanisms to do that. It's all it's clear. They are black and white. So you have to follow the procedures. So the government.
So that would mainly be the concern of the NMRA.
NMRA plus the procurement procedures. Okay. Because it's by the MSD, and that whole system has to be more efficient, and then also minimize wastage. There's a lot of wastage in our system, and so address those. Then the next, of course, priority is how to stop our health personnel from migrating to other countries. So here I think we have to look at what are the pull factors, what are the push factors. Push factors we can address. There are, of course, the remunerations and all the benefits given to doctors. There are disparities. Some grades can be okay with what they are receiving, but on the average, our doctors need more facilities, more incentives to, particularly those who are working in the periphery. They are making a huge sacrifice, and their children's education, all those things. Then the tax regime has also caused lot of concern, and it is affecting those younger doctors who are trying to set up their families, construct a house and all those things. So you have to look at very sympathetically what are the factors that are making doctors to think of migrating to other countries, right? Then also strict enforcement of some of the, say, bonds that are being made to for foreign the doctors who go for foreign trainings. If they don't return, there's a bond. Enforcement is not happening, so that at least it's a deterrent for them to be not honouring these commitments.
Usually, doctor, what is the content of these bonds? I'm purely asking you because I'm unaware of how
it's
that really
simply a financial. There's a amount, and you have to.
So does it work that the doctor deposits that certain amount in a bank account of the government and then leaves?
No. If it is deposited, then it's easy.
It's a surety. It's a surety.
Yeah, no, but it's a document. It's a contract which pledges that.
So if the doctor migrates overseas and then takes his family, who are going to enforce it against?
No,
doctor?
you can still enforce, because I think there are also ways that, and some have paid, and of course the other problem is that you have there is a code of ethics, code of practice that is adhered to by all WHO member countries on health personnel migration.
Right.
So the recipient countries have to be conscious of the negative impact it's going to have on the low income countries who are producing these doctors. So that's not happening. So I think the government.
So why is that not happening, doctor? Is there any way that our government can intervene and seek assistance from these international organizations?
Absolutely can, but
that is not happening.
No, that's not happening, and more than the government encouraged professionals to leave, which included doctors last year.
Why was that?
To give to get
back more dollars.
Yes, of course. So that was not a wise decision, no, because.
But doctor, this is quite news for me. I mean, the government did encourage people to seek employment overseas, but I've never really heard the government coming out and saying that we are encouraging doctors or professionals to go overseas. Was that the case?
No, it's a blanket provision for all government servants, for can take leave and then go abroad. So that included professionals like doctors. Yeah. So there are many things that you could do, and also because the Ministry of Finance and the bilateral and multilateral donors, the development partners, are committed to help Sri Lanka at this point. So I don't think there's a resource constraint. We have to get our act together and plan, and then identify where the urgent problems are. Otherwise, now there are many hospitals where they are closing down even ICUs, because there are no these anesthetists and other specialists are not there. Even pediatric units, yesterday we heard that one teaching hospital that unit was closed because the doctor retired, the specialist pediatrician retired, and there was no replacement. So it's a very unfortunate situation, because we will see in couple of months time or maybe a few years time how these avoidable deaths, these are all preventable deaths. No, I mean, it's a crime, and we can't, as a nation which values human lives, we can't let this continue. So that is why I think it's a collective responsibility, and the government really needs to look into this without further delay, and involve organizations like the SLMA and other professional colleges, and also the public interest groups, try to address this problem. The resources, additional resources could be mobilized even through donations. There are, I mean, we personally know that there are many organizations who would, at least for the next 6 months to 9 months, who are willing to supply certain substantial quantities of medicines, which are approved medicines from reputed suppliers. So now there is a mechanism, and also actually SLMA did quite a bit of lobbying, and also we have an intercollegiate committee, that is we have about 40 different colleges in the health sector, medical sector, and with that committee we helped the health ministry to come up with the essential drugs list, which was more than 1000 earlier, and it's now about 860, I think, and also the priority lists and the quantities all were worked out. Those are the hard work that colleges and the SLMA did, so to help overcome this situation. So we have to continue our efforts, and we'll see that our decision makers take these recommendations seriously and act on them.
Doctor, according to your assessment, the health sector of the country, where does it stand now as compared to maybe this time about 6 months ago? Is it tilting towards the better? Is it still on the fence? Is it hard to say?
No, I think it's getting worse.
It's getting worse.
It's getting worse. Absolutely, because now last year 700 doctors left this country. This year we don't know the exact number, because some doctors leave without even resigning. So, even the ministry doesn't know. So, they are just vacating the post, which is also unethical. But at the same time, when you look at the issue from the doctor's perspective, then they also have valid reasons for that. So, we are in a serious situation. So, I mean 6 months ago, I think we didn't have closure of units, treatment units, hospital units, teaching hospital units, but now it's happening. So, that's why I say that the situation is getting worse.
So, Doctor, just one final question. Is the government aware of these units closing down? Do they have a team monitoring how bad the situation is getting? What's the progress there?
Yes. So, I think they are very well known to the administrators. They know, and they are also probably our health administrators are also trying to mitigate by sometimes referring some of these specialists to look after other hospitals, but it's not sustainable. It can't last long. You can, I mean, a specialist can cover 2 or 3 hospitals, but that's not the solution, because with the patient load you can't do justice to the patient. So, we have to find long lasting solutions that could come only by sincere efforts, putting this as the priority, that saving lives is important, resourcing the health sector is important, collective efforts are required here, and even the trade unions are willing to cooperate. There are proposals given, very positive proposals given even by organizations like the Government Medical Officers Association. So, I think that's enough and more solutions that have been proposed. It's only in the implementation, then we can overcome this situation.
Thank you very much, Dr. Ariyaratne, President of the Sri Lanka Medical Association, and of course during these grim times that our country is facing, not only in the health sector but across all other aspects here in the country, but especially the health sector. Doctor, we wish you and the SLMA all the best to push for a better health system here in Sri Lanka, or at least to rebuild from what's left of the health sector here in Sri Lanka. Thank you very much, Dr. Ariyaratne, for joining us on our show.
Thank you for inviting.
And thank you very much to all our viewers out there for tuning in, as you always do. Until we meet again, take care and God bless.